India's Prime Minister Narendra Modi has, for the first time, sounded the alarm about the rapid spread of the coronavirus in the country's rural hinterlands. He's urging villagers to keep informed about COVID-19 and seek medical help if unwell.
इसमें गांव के लोगों की जागरूकता, हमारी पंचायती राज से जुड़े जो भी व्यवस्थाएं हैं, उनका सहयोग, उनकी भागीदारी उतनी ही आवश्यक है.
With about 343,000 new infections, India's total tally has now passed 24 million. Experts blame India's second wave on state elections that went ahead last month despite escalating infections. An investigation is underway to find out if COVID-19 protocols were followed during campaigning. In the state of Uttar Pradesh alone, more than 700 teachers roped in to help with the polls have died from COVID-19.
नहीं जा रहा है भैया, बहुत समझाए, हम कहने इतने महामारी में ना जाओ लाल, कहीं ना जाए तो हमारे भाई यार हो जाइए, मम्मी ना करने ड्यूटी.
Ishan Garg joins us live from New Delhi for more. Ishan, Prime Minister Modi finally acknowledging the crisis in India's countryside.
Absolutely, Steve. And it was only a matter of time before he did that, because the numbers that we've been seeing from the rural areas have been absolutely staggering. In the state of Uttar Pradesh, the most populous state in the country, almost 70% of all infections are now coming. Almost 60% rather, infections are coming from rural areas. And India's largest state of Rajasthan, there about 70% of all cases are coming from rural areas. So it's increasingly becoming a rural pandemic. Now, Prime Minister Modi pointed out that there are two very important things that people need to do. First of all is the role of COVID-appropriate behavior, so wearing of masks and following social distancing. And experts are already poking holes in this theory, because they are saying that the concept of mask, if anybody has ever been to rural India, doesn't really exist there. A lot of people are not scientifically literate enough to understand how masks are going to protect themselves. There are not a lot of pharmacies in rural areas where the medical health infrastructure is extremely poor. So usage of masks is going to be an issue in rural hinterlands. And as for social distancing, because of the scientific illiterate community, the adherence to social norms and protocols like this can also be very difficult to enforce. Now, the second point that Prime Minister Modi made about the role of local leaders and panchayat leaders, that's going to be incredibly important. I've been speaking to experts trying to understand how one does send across this message of the correct treatment and diagnosis of COVID-19 and just the correct understanding of when one should go to a medical professional. And they say that local leaders, people who are trusted by the villages, they have to play an absolutely crucial role. But at the same time, there are calls to the government asking for a renewed support structure for the medical health infrastructure, because that's what's going to be absolutely important. Currently, a number of people have to travel tens of kilometers to reach the nearest cities where medical infrastructure is available. And because of all of these factors combined, the pandemic that was once contained in urban centers is absolutely ravaging through the rural areas right now.
And Ishan, Prime Minister Modi has also defended the slow vaccination rollout of his administration.
Yes, he has. He said that the country is now on a war footing and that the government is making all necessary efforts to make sure that people are vaccinated on a priority basis. The government has also clarified time and again through a number of health ministry press briefings that the priority at the moment is to give the first dose of the vaccine to people above the age of 45. And the expanded vaccination drive, which includes people between the age of 18 and 44, is an optional one. So states can choose to vaccinate these people if they've got the resources. And it seems clear from the government's idea that the priority right now is to protect the vulnerable groups. Now, the government is saying that it does have enough vaccines, and it's also hoping that it will have about 2 billion shots by the end of this year, which will mean that there won't be a vaccine shortage. But the problem really here is that the government is including a number of potential jabs that are yet to be approved by the medical regulators in the country. And at the moment, only 2 vaccines have been approved, and the quota of those 2 vaccines is only good for a few million doses. So experts are saying that instead of making promises to the government, to the public, that 2 billion doses would be available, the government should ramp up the existing domestic manufacturing.
All right, Mary, thanks for that update. Ishan Garg speaking to us from New Delhi.